Attention Deficit Hyperactivity Disorder. Attention Deficit Hyperactivity Disorder, ADHD, affects children and teens and can continue into adulthood. ADHD is the most commonly diagnosed mental disorder of children. Children with ADHD may be hyperactive and unable to control their impulses. Or they may have trouble paying attention. These behaviors interfere with school and home life. It's more common in boys than in girls. It's usually discovered during the early school years, when a child begins to have problems paying attention. Adults with ADHD may have trouble managing time, being organized, setting goals, and holding down a job. They may also have problems with relationships, self-esteem, and addiction. Symptoms in children. Symptoms are grouped into 3 categories. Is easily distracted, doesn't follow directions or finish tasks, doesn't appear to be listening, doesn't pay attention and makes careless mistakes. Forgets about daily activities, has problems organizing daily tasks, doesn't like to do things that require sitting still. Often loses things, tends to daydream. Hyperactivity. Often squirms, fidgets, or bounces when sitting, doesn't stay seated, has trouble playing quietly, is always moving, such as running or climbing on things. Talks excessively, is always on the go as if driven by a motor. Chronic lateness and forgetfulness, anxiety, low self-esteem, problems at work, trouble controlling anger, impulsiveness. Substance abuse or addiction, unorganized. Procrastination, easily frustrated, chronic boredom, trouble concentrating when reading, mood swings, depression, relationship problems. Causes of ADHD. The cause of ADHD isn't known. Researchers say several things may lead to it, including heredity. ADHD tends to run in families. Chemical imbalance. Brain chemicals in people with ADHD may be out of balance. Brain changes. Areas of the brain that control attention are less active in children with ADHD. Poor nutrition, infections, smoking, drinking, and substance abuse during pregnancy. These things can affect a baby's brain development. Toxins, such as lead. They may affect a child's brain development. A brain injury or a brain disorder. Damage to the front of the brain, called the frontal lobe, can cause problems with controlling impulses and emotions. Sugar doesn't cause ADHD. ADHD also isn't caused by watching too much TV, a poor home life, poor schools, or food allergies. ADHD can't be prevented or cured. But spotting it early, plus having a good treatment and education plan, can help a child or adult with ADHD manage their symptoms. ADHD treatment. Many symptoms of ADHD can be managed with medication and therapy. Special education helps a child learn at school. Having structure and a routine can help children with ADHD a lot. Behavior modification teaches ways to replace bad behaviors with good ones. Psychotherapy, counseling, can help someone with ADHD learn better ways to handle their emotions and frustration. It can also help improve their self-esteem. Counseling may also help family members better understand the child or adult with ADHD. Social skills training can teach behaviors, such as taking turns and sharing. Support groups of people with similar problems and needs can help with acceptance and support. Groups also can provide a way to learn more about ADHD. These groups are helpful for adults with ADHD or parents of children with ADHD. Attention Deficit Hyperactivity Disorder, ADHD, is a condition in which a person has trouble paying attention and focusing on tasks, tends to act without thinking, and has trouble sitting still. It may begin in early childhood and can continue into adulthood. Without treatment, ADHD can cause problems at home, at school, at work, and with relationships. In the past, ADHD was called attention deficit disorder, ADD. The exact cause is not clear, but ADHD tends to run in families. The three types of ADHD symptoms include trouble paying attention. People with ADHD are easily distracted. They have a hard time focusing on any one task. Trouble sitting still for even a short time. This is called hyperactivity. Children with ADHD may squirm, fidget, or run around at the wrong times. Teens and adults often feel restless and fidgety. They aren't able to enjoy reading or other quiet activities. Acting before thinking. People with ADHD may talk too loud, laugh too loud, or become angrier than the situation calls for. Children may not be able to wait for their turn or to share. This makes it hard for them to play with other children. Teens and adults may make quick decisions that have a long-term impact on their lives. They may spend too much money or change jobs often. ADHD is often diagnosed when a child is between 6 and 12 years old. Teachers may notice symptoms in children who are in this age group. First, the child will have tests to make sure that he or she doesn't have other problems such as learning disabilities, depression, or anxiety disorder. The doctor will use guidelines from the American Psychiatric Association to diagnose ADHD. The doctor may also look at written reports about the child's behavior. Parents, teachers, and others who have regular contact with the child prepare these reports. There is no cure for ADHD, but treatment may help control the symptoms. Treatment may include medicines and behavior therapy. Parents and other adults need to closely watch children after they begin to take medicines for ADHD. The medicines may cause side effects such as loss of appetite, headaches or stomach aches, tics or twitches, and problems sleeping. Side effects usually get better after a few weeks. If they don't, the doctor can lower the dose. Therapy focuses on making changes in the environment to improve the child's behavior. Often, counseling and extra support at home and at school help children succeed at school and feel better about themselves. Many adults don't realize that they have ADHD until their children are diagnosed. Then they begin to notice their own symptoms. Adults with ADHD may find it hard to focus, organize, and finish tasks. They often forget things. But they also often are very creative and curious. They love to ask questions and keep learning. Some adults with ADHD learn to manage their lives and find careers that let them use those strengths. Causes. No one knows for sure. ADHD probably stems from interactions between genes and environmental or non-genetic factors. ADHD often runs in families. Researchers have found that much of the risk of having ADHD has to do with genes. Many genes are linked to ADHD, and each gene plays a small role in the disorder. ADHD is very complex and a genetic test for diagnosing the disorder is not yet available. Among the non-genetic factors that may increase a child's risk for developing ADHD are smoking or drinking during pregnancy, birth complications or very low birth weight, exposure to lead or other toxic substances, extreme neglect, abuse, or social deprivation. Food additives like artificial coloring, which might make hyperactivity worse. Some studies suggest that artificial food additives and dyes may worsen hyperactivity and inattention, but these effects are small and do not account for most cases of ADHD. Children with ADHD can get better with treatment, but there is no cure. There are 3 basic types of treatment. Medication. Several medications can help. The most common types are called stimulants. Medications help children focus, learn, and stay calm. Sometimes medications cause side effects, such as sleep problems or stomach aches. Your child may need to try a few medications to see which one works best. It's important that you and your doctor watch your child closely while he or she is taking medicine. Therapy. There are different kinds of therapy. Behavioral therapy can help teach children to control their behavior so they can do better at school and at home. Medication and therapy combined. Many children do well with both medication and therapy. Hyperactivity impulsivity. People with symptoms of hyperactivity impulsivity may often fidget and squirm in their seats, leave their seats in situations when staying seated is expected, such as in the classroom or in the office. Run or dash around or climb in situations where it is inappropriate or, in teens and adults, often feel restless. Be unable to play or engage in hobbies quietly, be constantly in motion or on the go, or act as if driven by a motor. Talk non-stop. Blurt out an answer before a question has been completed, finish other people's sentences, or speak without waiting for a turn in conversation. Have trouble waiting his or her turn. Interrupt or intrude on others, for example in conversations, games, or activities. Diagnosis of ADHD requires a comprehensive evaluation by a licensed clinician, such as a pediatrician, psychologist, or psychiatrist with expertise in ADHD. The doctor will also ensure that any ADHD symptoms are not due to another medical or psychiatric condition. Most children with ADHD receive a diagnosis during the elementary school years. For an adolescent or adult to receive a diagnosis of ADHD, the symptoms need to have been present prior to age 12. ADHD symptoms can appear as early as between the ages of 3 and 6 and can continue through adolescence and adulthood. Symptoms of ADHD can be mistaken for emotional or disciplinary problems or missed entirely in quiet, well-behaved children, leading to a delay in diagnosis. Adults with undiagnosed ADHD may have a history of poor academic performance, problems at work, or difficult or failed relationships. ADHD symptoms can change over time as a person ages. In young children with ADHD, hyperactivity impulsivity is the most predominant symptom. As a child reaches elementary school, the symptom of inattention may become more prominent and cause the child to struggle academically. Treatment and therapies. While there is no cure for ADHD, currently available treatments can help reduce symptoms and improve functioning. Treatments include medication, psychotherapy, education or training, or a combination of treatments. These medications take longer to start working than stimulants, but can also improve focus, attention, and impulsivity in a person with ADHD. Doctors may prescribe a non-stimulant when a person has bothersome side effects from stimulants, when a stimulant was not effective, or in combination with a stimulant to increase effectiveness. Psychotherapy. Adding psychotherapy to treat ADHD can help patients and their families to better cope with everyday problems. Behavioral therapy is a type of psychotherapy that aims to help a person change his or her behavior. It might involve practical assistance, such as help organizing tasks or completing schoolwork, or working through emotionally difficult events. Behavioral therapy also teaches a person how to monitor his or her own behavior, give oneself praise or rewards for acting in a desired way, such as controlling anger or thinking before acting. Parents, teachers, and family members also can give positive or negative feedback for certain behaviors and help establish clear rules, chore lists, and other structured routines to help a person control his or her behavior. Therapists may also teach children social skills, such as how to wait their turn, share toys, ask for help, or respond to teasing. Learning to read facial expressions and the tone of voice in others, and how to respond appropriately can also be part of social skills training.